I'm going to be presenting a 48-year-old woman that we treated here at my institution. She presented with low blood counts, but had 58% circulating blasts in her blood, and a bone marrow biopsy showed that her bone marrow was full of leukemic blasts at 99%, and these were of the B lineage. They were CD19 positive with other markers consistent with that diagnosis. There was no evidence of the Philadelphia chromosome or the BCR-ABL translocation. Her cytogenetics were normal, but she had a FISH analysis that showed an IgH translocation at position 14q32. We enrolled her on a clinical trial, the E1910 trial, which gave patients induction chemotherapy, and those patients that achieved a remission could then be randomized to continue consolidation chemotherapy or maintenance chemotherapy, or go on to get that same consolidation chemotherapy, but along with 4 cycles of Blinatumomab, which is a bispecific T-cell engaging molecule that brings a CD19 positive B lineage lymphoblast in close proximity to a CD3 positive T cell to facilitate killing of the blast by the T cell. So she did go into remission with chemotherapy. She was initially positive for measurable residual disease by flow cytometry, but this subsequently became negative. And initially in that trial, we were randomizing both MRD negative patients and MRD positive patients, but Blinatumomab got approved for MRD positive patients, and so we assigned patients who were MRD positive to get Blinatumomab, and we only randomized the MRD patients, the MRD negative patients. So she became MRD noted, and she was randomized as per the protocol, and she got an initial 2 cycles of Blinatumomab, and this is given by a continuous intravenous infusion for 4 weeks with a 2-week break in between. So she got 2 cycles of the Blinatumomab, and then she remained MRD negative as a result of that. She could have at that point continued on chemotherapy, but we felt that with her IgH translocation, she was at higher risk for relapse, and this was a few years ago. And so we took her to a myeloablative transplant from her sister, who was a half match with her. So a haploidentical transplant, and she had some complications related to that, some fevers, and she had some graft versus host disease that fortunately was controlled with corticosteroids. But she subsequently has remained in remission, and up to this time, she remains MRD negative in full remission and is doing well.